Because Angie is absolutely amazing. She's a health coach. She's a registered dietitian who studied at the University of KZN in South Africa. And in KZN, she had a big practice where she worked in hospital. And she also had a own dietitian clinic in sports and wellness. Angie is also the author of the book Freedom with Food. Thank you so much for being here, Angie.
Well, thank you for that introduction, Daniela. Yes, I really do love people. That's one thing for me, is my heart is to see people doing really well and excelling in what they love doing and enjoy doing, but in a holistic way, in a holistic, healthy way. Like you said, like yourself, I've worked in hospitals for a long period of time, and I've worked with a wide variety of different people, different age groups, from neonates right the way through to the elderly, different walks of life, different cultures, different conditions. And I just love the fact that nutrition is like medicine. It can be used as a medicine to help people feel well and full of energy and just good and healthy and strong again. So as you mentioned, I did also have a practice in a sports and wellness clinic. So I do have a passion for sport nutrition as well. And I love working with athletes.
And then you generally like working with people. So you did further training as a health coach, a life coach, and you also did training through the Institute of Functional Medicine regarding nutrition.
Yes, that's right. And that was such an exciting time. Those courses are just amazing. And like I said, using nutrition as a preventative measure, using nutrition to group people together and as a social thing, but also as a nutritional thing, as a medicinal thing, it's my passion.
Good. So I'm very fortunate to have Angie working with me here. We're both in Oakville in Canada, where we work specifically with athletes and actually anyone who really needs that one-on-one nutrition coaching. She brings so much wealth to the table regarding nutrition and the coaching aspect to help people to take them by their hands. As a physician, I've often found I would tell people, you must just lose weight. But I didn't really know how to help them. And that's why I partnered with Angie, as she has those skills to have someone, when I meet someone and say, you must just follow this diet, ABC diet, then she can partner with the person to say, but how are we going to implement this diet? What is going to work with you? And we can talk more about coaching, what it is, what it looks like.
Yeah, so as a young child, I actually wanted to get involved with anything medical. I really wanted to work with people and help people. I love caring for people and serving people. So for me, getting into a medical field like dietetics was something that I always wanted to do. And then when I studied at university, I really just enjoyed just the different aspects of nutrition, right the way through the life cycle. And then I trained dietitians at university, and I was a lecturer there, and I really, really enjoyed that. And so it's always been a thing in me to just really love people, empower people, and see them do well. I love to come alongside people and support them. And I think that's where the health coaching thing for me is so, it's such a great thing, because it really helps to support people in setting their goals for what they desire to do. So
that goals is a big thing. Tell me a bit more about goals. Why do we need goals? What are goals?
Yeah. So I think setting goals is such an exciting process. Actually, it gets me really excited because it brings a lot of direction and it gives hope to people. It really, each and every individual person is so different. We know that. And according to an athlete or any individual really who has different lifestyle experiences, different skill level, different schedule to follow, each and every person is going to have a different goal. Even if they have a similar goal, they're going to have a different way of getting to that goal. So taking a goal and breaking it down into smaller steps is a really important thing to do so that it doesn't feel overwhelming and that it brings that direction, like I said. So
I mustn't just tell you that I want to lose 20 pounds.
Exactly. Because how are we going to do that? So I always like to ask people why. What is your why? And even when they've answered like what their why is, so like for example, if they wanted to lose 20 pounds to feel healthier, then there needs to be a second why as well, even a third why, to really get into what is the real motivation behind it, because it's that at the end of the day that's going to help to inspire that person to reach their goal as well. So setting goals, there's certain goals that will help to motivate a person. For example, developing a new skill or something that draws somebody towards that goal. And making small little goals instead of broad ones. Like you said, I would like to lose 20 pounds. Now, that's a great goal to have. But what are the small steps that lead us to that 20-pound weight loss or 20, whatever they are aiming for? Is it smart? And that's what we like to use is it smart?
Yeah, so tell our viewers, what does SMART stand for? Because I know when you work with clients, you work through SMART goals. And SMART is an acronym.
Yes, it's an acronym. And it really does help to keep this in mind. I have this saying from the time I was young. Proper prior planning prevents poor performance.
Oh my goodness, that's a tongue twister. Okay. Proper prior planning prevents poor performance. Oh, and that's so applicable for our triathlon nutrition as well, right?
Exactly.
Okay.
So having that in mind, if we plan appropriately, then we can really meet our goals. So SMART stands for S is for specific. So that is really the intrinsic detail of the goal. The why, the how, the when, the which, the who, all of the little details that is going to make the goal specific. So not too broad, but just narrow it down. Then the M stands for measurable. So how are you going to track your progress? How we know that we're getting closer to that goal? The A stands for achievable. So it needs to be agreed upon, attainable, and achievable. So
that's yes. So I can't just say, I want to run 100 meters in 10 seconds. You're like, wow, is that achievable or not?
Exactly.
So let's get a realistic goal.
Exactly.
And then, but as you also say with SMART, be very specific. So I don't just want to run faster. How far do I want to run at what pace?
Yes, exactly.
But then is it, I'm not, Usain Bolt. Is this achievable?
Is it achievable?
Okay, that's good.
It's got to be possible, right?
Yes,
We're not trying to do the impossible here.
Yes.
And then realistic.
So you're not that good of a coach that you can help with the impossible.
I'm not going to make you do the impossible.
You're an amazing coach.
So it needs to, and the thing is, it needs to be agreed upon. Like even as a coach, for me, the most important thing is I don't set the goal for the clients. It needs to be their desire. Because nobody likes to be told what to do. So I'm not here to tell other people they must meet my goal. No, it's what is their desire, but what is their urgency as well. So that's where the attainable and agreed upon is something that person must decide that they really feel that they can do and it's achievable.
And then the urgency is something as well, right? Because I have patients quite often that say, they want to lose weight. But then once a physician says, okay, I will do a knee replacement for you if you lose 10 kilograms, then suddenly they have, okay, I want to lose 10 kilograms to get my knee replacement.
Exactly.
Or it's bikini season, I want going on that trip, then it's, okay.
And that's why that why question of why do you want to set this goal is such an important thing.